So my name's Abby. Thank you for joining. So I'm a public health officer in the addictions team at Birmingham City Council. Thank you for joining the webinar. It's exploring the challenge of addiction and its effects on the LGBTQ plus community. We have Chris here as well, so I'll let you introduce yourself. He's going to be presenting.
Thank you, Abby. So I'm Chris. I'm from Birmingham LGBT. I'm the lead development officer for our substance support service here. So that service has been going for just under a year now. We're coming to the end of our pilot scheme. But prior to that, I've worked within our sexual health team for 6 years, working with people engaging in chemsex. So got a little bit of insight into the community side, so come to share that today.
Thank you. So I'll start by sharing my screen. Have a couple of sort of introduction slides and then move on so you can start the presentation. Okay. Can everyone see my slides? Are they sharing? Okay.
Yes.
So this webinar will be on exploring the challenge of addiction and its effects on the LGBTQ plus community as part of the Birmingham LGBTQ plus History Month Health Conference. So just a little bit of sort of housekeeping to start. So we want all of our events, workshops and webinars taking place throughout the Pride Well Summit conference to be safe places for everyone to learn, share and grow. So the approach that we expect of our hosts and attendees listed below, so I'll just go through those. So we have respect. So above all, we respect one another. Empathy, we will acknowledge the feelings, experiences and identities of those around us. Care, so we will create non-judgmental, caring spaces for people to be authentic. Support, so we will listen, empower and support each other. And then inclusion, so we will include all LGBTQ plus identities and experiences, ensuring that we actively create inclusive spaces for seldom heard people within the community to be heard and to be seen. Second. Okay. So our aims of this webinar will be to explore drug and alcohol use and harms within the LGBTQ plus community, to explain what chemsex is and its prevalence within the LGBTQ plus community, to raise awareness of the health inequalities experienced by the LGBTQ plus community because of alcohol and drug addiction, to increase the understanding of the existing services and referral pathways, and to discuss the gaps and barriers to treatment and some solutions to engage more of the LGBTQ plus community into treatment services. Then, Chris, do you want to start from?
Yeah, brilliant. So thank you again for having me along. So what I've done, I've put some slides together trying to just show some data that I could find. It was very hard to actually find a lot of information. I couldn't find too many studies or reports that specifically aimed at the LGBT community. So I took a lot of the information from the LGBT in Britain survey that was done by Stonewall a few years ago, just because it had reached one of the largest numbers of LGBT people across Britain. So there was over 5,000 LGBT people surveyed, and there was a response of almost 2,000 people. So it hit quite a large chunk. We hear bandied around quite often that the LGBT community is affected by drug and alcohol misuse a lot more than sort of general society. So I just wanted to show these charts here. So LGBT people who drink almost every day, and you can see that the older generations seem to be affected a lot more by this. Could there be a reason for it? A lot of things that we need to do is sort of dive deeper into the LGBT community and look sort of back to basics. Growing up in an LGBT sort of world, or lack of thereof, the LGBT community tends to be very much sort of bar focused, and safe spaces tend to be sort of focused around bars. People spend a lot longer within these sorts of environments and form their own communities, their safe spaces, safe housing. And so this could be one reason why sort of drinking becomes a problem, because it's not only drinking to mask other issues, but becomes a safe space. Couple of things. 1 in 6 LGBTQ plus people said that they drank almost every day. And according to the National Office of Statistics, 1 in 10 adults in general drink alcohol on 5 or more days a week. So it shows the disparity there, difference in LGBT people drinking more often. As I say, this could be because going out to bars is this safe space. It is where social experiences happen. Or it could be to suppress other stresses, triggers, traumas, such as hate crime, discrimination within general society. LGBT people who take drugs at least once a month seems to be affecting younger people. And as you go through, population tends to sort of decrease. But looking at 18 to 24-year-old LGBT people, 1 in 8, so 13% of the respondees said they take drugs at least once a month. And according to the Home Office, this compares to 1 in 11 of the general population, being 16 to 24. So although it doesn't look like there's great difference when you look at sort of the numbers of people, it does show that there is this impact effect in the community. Brilliant. So if we flip over a little bit, we're going to talk sort of more into chemsex for a moment. If people are aware or aren't aware of what chemsex is, so chemsex is the planned use of drugs as an integral part of sex, usually immediately or prior to or during sex. The term chemsex was sort of coined a few years ago and focused predominantly on 3 types of drugs, which crystal meth, methamphetamine, MCAT, methadone, or gamma hydroxybutyrate, which is GHB. Other drugs may be used, things like ketamine, cocaine, even things like marijuana. So with the coining of the term, it very much focused on these 3 drugs. But what working with over the last few years I've noticed is alcohol in itself is a substance, it's a drug. People don't wake up one day and start taking crystal. There's a sort of cycle, a pattern that leads into it. Involving chemsex, risk factors are extremely high due to intoxication. People lose their inhibitions, may put themselves at higher risk of sexual practice, high numbers of sexual partners, and longer extended sex sessions. With these drugs, it's not just normally snorting. People will inject smoke, and with GHB, it's an oral fluid that is swallowed. So the risk of overdose going under is extremely high. With, sorry, I've lost my train of thought there. So mental and physical health can also be impacted with this. So what we've sort of discovered, people don't just wake up one day, as I say, and start, oh, I'm going to start taking drugs for sex. There often seems to be a pattern that leads down into that. People could be fighting their own sort of internal battles. Within the community itself, there's a lot of negativity sort of battered around between body image, about age. There's a lot of discrimination within the community. So, and then when you've got the wider issues with hate crime, people being targeted, walking down the street, you just have to make a choice of, are you going to hide your true identity? And it can cause a lot of mental health issues. Physical health, the impact that it has whilst people are at these sessions, they're not something that lasts for a couple of hours. They tend to go on for days, even week-long sessions. And so within this, people aren't eating, people aren't drinking. And so this is having obviously pressures on the human body as well. There's again not been that many studies out there that I could pull sort of specific data, especially in Birmingham, but back in 2017, there was a self-report survey put out there by 20 sexual health clinics in the UK, and this showed that 21.8% of the people who had responded had engaged in chemsex within the past 3 months. And so I feel it's important that we try and look to see if that number has increased. I know I started in 2017 working with chemsex clients, and we'd get maybe 4 or 5 trickling through over a series of months, but we seem to be getting a lot greater numbers now. So one thing that I discussed on Tuesday with Umbrella Sexual Health in Birmingham is that we might try and get a survey done so that we can get some up-to-date data on that. Brilliant. If we go to the next slide. So looking at sort of some of the health inequalities faced by the LGBT community, why aren't people sort of coming forward accessing services? And so some of the information that I found, LGBT people who have experienced lack of understanding by healthcare staff, it seems to affect the lesbian community at the highest, by women, then followed by gay men and bisexual men. And people who have experienced unequal treatment, again, lesbian women seem to come out quite on top. So are we missing something? My question there is, how much do we focus on things being aimed at gay men, bisexual men, men who are sexing men? The term chemsex was coined only looking at gay, bi, and men who have sex with men. And so women and trans people were excluded from sort of the classification of what chemsex is. So there's a disproportionate amount of questions that are being asked to men specifically and maybe not to women. Sorry, I'll read comments in a moment. So 1 in 10 LGBT people have been outed without their consent by healthcare staff in front of other patients. So this could be people waiting in the waiting room around gender identity. It could be people who are inpatients in hospital. It could be people who have come for appointments in clinical settings and have been used as a topic of conversation. 1 in 4 LGBT people have experienced inappropriate curiosities from healthcare staff. And what do we mean by that? So when we're supporting people, when we're working with people, there's information that we need to know that's relevant to the care and support that people are receiving. When we're asking questions that are to fill gaps in our own knowledge or are not relevant, then this can be classed as inappropriate curiosity. And so it's becoming apparent that people are finding that they're being used as a source of information as opposed to actually receiving the support they need. Almost 1 in 4 LGBT people have at one time witnessed discrimination or negative remarks against LGBT people by healthcare staff. And this is something that I've had clients come and talk to me about. They have been to different services and have just found it difficult to open up, or when they have opened up, remarks have been made about what they've disclosed in a negative sort of manner. And it could be due to lack of understanding, it could be the way things are put across, but that's been perceived as a negative impact. Could we go to the chat and just find out what the question was? Sorry, Abby. I've got a button, I can do that myself, sorry. Results that sort of. It would be really good to have a similar sort of study again, so that we could get sort of up-to-date information and specifically focusing on drug and alcohol services. And so it's something that, yeah, really should be done. Brilliant. If we flip to the next. So I've mentioned sort of a couple of times just some of the barriers that people are facing within mainstream services. Issues such as homophobia, biphobia, transphobia, we see it battered across the media and everything at the moment. There seems to be a high prevalence of transphobia just put out into the media. So it's becoming the social norm and as if it should just be accepted. People are struggling on a day-to-day basis, and when it's so openly happening in media, the impact that it's having on people's mental health and well-being, it is extremely detrimental. There's bullying due to sexuality and gender identity, lack of representation and visibility of LGBT people and their rights. So when people are accessing services, is the visibility of LGBT people in those services? Are posters around? Are people showing that there is representation within these organisations? Stigma associated with sexuality. Looking at chemsex, oh, it's just men, they have going out having sex, they doing this, it's a normal thing, it becomes normalized, becomes stigmatized of all gay men are just using drugs. HIV related stigma is still highly prevalent, and it's still drummed as a focus that the high prevalence rate in the LGBT community. But if you look in the wider community, the most recent report on HIV new diagnosis was actually at heterosexual male and females. I think it was female with heterosexual females that came out as the highest prevalence of newly diagnosed in recent years. But yeah, it's still battered across as it's a gay disease. And so education that testing should be for everybody, and like in that respect. Discrimination and hate crime. The prevalence of hate crime over the last few years in Birmingham alone, I can just pull up another slide actually that's not going to be on your presentation, but if you bear with me a moment, I've got a report of...
I'll just stop you there.
Nobody thinks I can do apologize. So back in 2018 in Birmingham, there was 530 incidents of LGBT hate crime reported. Back in 2021, this had rose to 1,463 incidents. And so does it mean that just more people are aware and are reporting these issues, or does it mean that it's happening more and more? We know that there's been a lot of targeted attacks within the Her Street in Birmingham. People will hire cars, drive up and down the street, shout homophobic abuse. And there's also been vicious attacks on people within the street as well. This has sort of increased tenfold basically, and since, I would say, especially with lockdown, people seem to be a lot more sort of scared going out into the community. It could be due to sort of finances, things like that, but we've noticed that the scene isn't getting as many people out, and so people may be isolating, shutting themselves off from the community, which then is having this greater impact on the mental health issues. People, if they're drinking alone, if they're using drugs, substances, anything like that, are they doing it in a safe environment? Are they reaching out or even aware of what support could be provided for them? So with sort of the things that I discussed about sort of the disparity in health and sort of support, this can end result, we can go back to the slides if that's okay, Abby. Sort of a lot of internalized homophobia, biphobia, transphobia, poorer mental health outcomes for people within the LGBT community, causing a disproportionate use of drugs. People use drugs and alcohol, as I say, as a social factor. The LGBT scene, people create their own community, their own family groups by people that they're seeing out and about on a daily basis, prolonging people's stay within sort of the bar scene, the club scene. People who, new generations come along, people get a lot of ageism within the community, people get outdated. I'm 34, I feel too old to be going to a lot of the bars and venues now as the younger waves come through, as the scene changes and as different things develop. So I'm quite lucky, I've got a stable relationship. People who don't have those sorts of things, may seek other ways to connect with the community. Chemsex in itself is a community within a community, and so people are engaging in drug use not only for sexual practice, but because it's a way of staying with like-minded people. It becomes the whole social structure. When we're supporting people and we're saying, okay, we need to try and bring you away from that, it's not only looking at the drug use that we're trying to stop people engaging with, it's you're breaking down their whole social structure, looking for healthier ways to connect with people that aren't focused around drug use. Do anybody else have any other ways that we think we could overcome these sorts of issues? Please feel free to shout out. Hand up somewhere.
Oh, it's I've got it. Would it be to educate professionals so that they do feel engaged within the mainstream treatment system as well?
I think that's really important, and I think this may be sort of a time I've printed off just a piece of feedback that I've received from a client this week actually, which really fits with that question. So I was struggling with my relationship with substances and my relationships with others, and I'd had previously engaged with a general support service. I found a business card for Change Grow Live LGBT, and I reached out for support. I didn't know what to expect, but I knew I needed help, and I met Chris, who arranged a meeting with me, and we just spoke about my life. It was a different approach to other support services. Previously, I did 6 sessions and that was it. But with Chris, I was able to come in as much or as little as I wanted. I was given tasks to think about or do between sessions, and I was able to think about my relationships in a different way. I was in a spiral of just going to chem sessions and I just wanted to stop. Chris really helped me to come to conclusions and solutions and felt like someone was hearing what I was saying. It was also good to have someone understand the LGBT community. Chris knows the terms, the slang, and what gay men do. He also understood the world of chemsex, and he didn't judge me, and he just let me talk. I know if I ever needed to chat or a meeting, I can book in space. I've been on a sober journey, and it's good to know that help and support is there for me whenever I need it. In conclusion, compared to other services, it was good to have someone understand the LGBT community and talk to me about our community without having to explain what the terms or slang meant. I led the conversations and it felt like Chris was really listening to what I was saying. I was given some tasks to do and they've helped me understand and move forward. And so I think the sort of middle bit of the fact that I understand, I know the community, it's really difficult for people who aren't LGBT to be able to put yourself in the shoes of, but if we can have training, if we can have education, if we can learn and then share that we do have this knowledge, you don't have to be part of the community to understand, but it's expanding our teaching, our learning, our growing to be able to put more empathy into the support that we're providing. So a lot of people will come to support and will already have these internal barriers up and their perceived barriers that are there. And so people may feel uncomfortable if they feel that somebody doesn't understand because they feel they have to be filling the gaps in the knowledge. But just showing an awareness of, actually, I do know about chemsex, I do know what the terms, the slang means, can help break those barriers down from the offset. So yeah, so I do think sort of education training is sort of the way forward, and sharing experiences would be one of those sort of ways to overcome it. Any other thoughts? So if I just say about sort of, if we move on to the next slide about the existing service, I'll tell you a little bit about the service that we provide at Birmingham LGBT. As an organisation as a whole, we've been going for, I think it's 25 years now, and we've had different sort of support services come and go throughout, dependent on what funding we have. But at the moment, we have a partnership with Umbrella Sexual Health. So we work with the sexual health clinic and provide sexual health testing. We have the substance support service, which is in partnership with Change Grow Live, which is my service. And within this, we can support people with drugs, alcohol, or chemsex. Predominantly, we get a lot of chemsex clients come and access support through our service. We've got a domestic violence service for LGBT people across the West Midlands. We've got a counselling service, which we have LGBT specific and also trans specific counselling. We've got wellbeing support, again, for general LGBTQ plus and specific trans wellbeing. And we work with RSVP, the Rape and Sexual Violence Project, also Stonewall Housing. So we've got quite a lot going on and able to offer sort of the LGBT specifics services to people. Within the drug and alcohol service, we look at sort of a holistic initial assessment, and because everybody's sort of paths are different, they may cross at times, but support is very much individualised. It's LGBT affirmative in a safe environment, and we offer one-to-one support via telephone, online, or video calls. And it can be ongoing, but we do review it regularly. One thing I say to my clients is that I'm there to support as long as you need me, not as long as you want me. And we know that because there's so many extra factors, it's not drug and alcohol and chemsex isn't normally somebody's issue. It's a coping strategy. And so what we need to look at is the wider field and what changes can people make to live a healthier, happier life. So you can see some of what we can support around within this service as well. People can self-refer into the LGBT Centre by contacting via email or by phone. People can also even text into my work number, and we'll make contact with people. So we're breaking down the barriers. Sometimes reaching out for support can be the hardest, but a text message can seem a bit less scary than picking up the phone and speaking to an organisation. Professionals can also contact us, and we'll send out a referral form. And so we are very happy to receive calls or emails from professionals just seeking for extra support for any of their clients. So I think our contact details are just on the next page here. So our phone lines are open 6 days a week, and we're open 10 a.m. till 6 p.m. Monday to Wednesday, 10 a.m. till 9 p.m. Thursday and Friday, and 11:30 till 7 on a Saturday. For substance support, there's 1.5 of us. So I work full time, and my colleague Ruben works part time within the service. But over the 6 days, there's always one of us in, apart from 2 Saturdays in a 6-week period. So you'll always be able to get a quick response from us.